In this section, we're going to take a look at the concept of sexuality in relationship to menopause. The objectives are listed, but we will be looking at the physiology, etiology, and clinical manifestations of menopause, what risk factors are increased and associated with menopause, and then planning evidence-based care. We're going to be also looking at the student learning outcomes of providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy. Communicate effectively with patients, families, and members of the interprofessional team, and manage care for clients and groups in diverse settings. Menopause is defined as when menses stops. Typically, it needs to be 1 full year of an absence of menstrual cycles in order for a diagnosis of menopause to actually take place. Typically, it is between the ages of 48 and 55, but it can occur at any age, and it is a physiological process that occurs with all women. It also can be either surgically induced or chemically induced. So a surgical menopause is when the ovaries partial or complete hysterectomy takes place. And a chemical induced menopause is typically from chemotherapy, and it actually stops ovarian function. So what we're doing is we're taking a look at the hormone levels that are being altered in menopause. With menstrual cycles, the body produces estradiol, and this is the primary form of it's the active form of converting it to estrogen. So that the estradiol, it actually decreases, and it actually will have it be replaced by estrone, which is a much less potent form of estrogen. So estrogen levels do significantly decrease in menopause, and as a result, it also affects the progesterone levels as well, and they decrease. So by understanding that the estrogen levels significantly decrease in the postmenopausal woman, it actually explains the clinical manifestations. So because there is less estrogen in the body, various tissues are going to be affected. Breast tissue is going to be affected, the elasticity of the skin, the subcutaneous fat decreases and actually shifts to the abdomen and thigh region on postmenopausal women. There's also an increase in the vaginal pH, which results in a higher risk of urinary tract infections, frequency, burning, urgency, and then also vaginal infections as well. There is reduced vaginal lubrication because of the decrease in the estrogen level, which can be problematic with sexual function. So education for the postmenopausal woman as far as using lubrication during intercourse. There's actually a term, dyspareunia, which means painful intercourse because of a lack of lubrication. There's also a vasomotor instability that occurs, and it results in the hot flashes, more of the cardiac symptoms, the dizziness, the palpitations, and it also could lead to headaches as well. And then with long-term estrogen loss, it actually will result in bone remodeling and demineralization, and has a higher risk of osteoporosis. So again, looking at the clinical manifestations, it makes sense as to why the risk factors are the risk factors. So because of the vasomotor instability, there's also a change in the cholesterol levels. So postmenopausal women do have higher cholesterol levels. It actually does increase the cardiovascular disease. And the osteoporosis we mentioned on the previous slide, because of the bone remodeling and the demineralization, it can lead to osteoporosis resulting in fractures, and also kyphosis, which is that thoracic curvature of the spine outward. Also, higher risk for breast cancer because of those estrogen levels as well. And then the emotional impact of the menopause. So many women experience it many different ways. You really need to assess how each individual is experiencing menopause and meet the needs of the individual. In collaborating with other healthcare professionals, diagnostic tests, they can do the follicle stimulating hormone and the luteinizing hormone levels. Typically that's not done. They will be elevated in a menopausal woman. Typically though, they are looking at symptoms, and if you have not experienced a menstrual cycle within 1 year and you're having the other clinical manifestations and the symptoms, then they will actually diagnose as a woman being in active menopause. As far as treatment goes, it was commonly treated with hormone replacement therapy. However, there were studies done that it showed that there was an increased risk of heart disease and strokes, particularly. So the recommendations changed. However, in recent years, they actually have said that low doses of hormone replacement therapy of the estrogen and progesterone have reduced symptoms of menopause, but there is still a risk of increased risk of breast cancer, and there's an increased risk of strokes and blood clots as well. So it really needs to be discussed with each individual as far as the risks and the benefits of the hormone replacement therapy, and let it be their individual decision. Also, with hormone replacement for naturally occurring menopause, it is treated with estrogen and progesterone. With women that have had a hysterectomy where the uterus was removed, it is treated with estrogen only, and it does still have the same risks involved with both therapy treatments. And then as far as the nursing process, you really want to take a look at the whole process. You want to conduct your assessment. You want to encourage women to have cancer screenings. Mammograms should be done after the age of 40, and physician-provided breast exam should be done yearly as well. Encourage women to do self-breast exams, and then do a thorough assessment history of the individual, a physical exam. Diagnosis, they're listed in textbook, but knowledge deficit would be a significant one, to let the individual know what they are experiencing, why they are experiencing it, the pathophysiology behind it. So if they can understand it, then they can deal and cope with it better. Ineffective sexual patterns and sexuality patterns, and this really stems from the vaginal changes that are occurring, the increase in the pH and the decrease in the lubrication, to make sure that they still maintain a meaningful relationship with a partner due to the changes. And then situational low self-esteem and disturbed body image. Again, everybody is individual. Some women will be more affected with self-esteem and body image than other individuals. And then the planning process to develop an individualized plan to meet the needs of each individual, implement, and then you're going to evaluate as well.